Hi, so let's talk about terminal cancer. Terminal cancer is cancer that has no treatment, there's no cure. So, literally, your team of doctors will throw spaghetti against the wall to see what sticks. It's not any kind of comfort that there's nothing that will treat your cancer. You'll never be in remission. You'll never have that day of ringing a bell. You will have cancer the rest of your life, however long or short it will be. Terminal cancer also means that it limits a lot of your options. If you need an organ transplant, not for a terminal patient. Once you have cancer in 5 organs of the body, you are automatically excluded from the transplant list. It's no longer an option. So if you would need a kidney, or if you would need a heart, lung, anything, you're not getting it. That also means, that your treatments for your cancer damaging the healthier organs could also shorten your life expectancy. And it's a really heavy thing to have to carry around, knowing that if you needed an organ, that the transplant administrators, whatever you want to call that whole bureaucratic mess, is going to tell you no. You can be the strongest cancer fighter. You can be the most positive person. But you're not going to get that organ. Terminal cancer is heavy enough, but that really struck me when I was told I had a tumor that metastasized to my bladder. The bladder is one of the most delicate, if not the most delicate organ in the body. It doesn't rejuvenate, it doesn't heal. If there's damage, it's there permanently. Anything they do to that tumor will do damage to the bladder. So radiation would kill it immediately. The red death chemo would kill it immediately. So if we have to go that direction, my baby girl, she always wants to make sure mommy's okay. If we would have to go that direction, what does that mean? Well, that means you have to decide, would you rather have quality of life and have a bag to empty? Meaning that they would, yes, remove the tumor, but they would also remove the bladder entirely. And that means a bag and a tube coming out of your body. That prolongs your life because that tumor is gone, so they can refocus on others. Now she's moving. But that also means that you have another organ that's gone. They've already taken, they've already done a partial hysterectomy. They had to go back in and take the ovaries and the fallopian tubes because my cancer grows off hormones. Any hormone, any testosterone, any estrogen in my body grows my cancer. So a lot of my chemotherapy is hormone suppressors of both hormones, of all hormones. And Vanity, which is, partially the wigs, kind of makes me pause on having my bladder removed, because trying to remove that tumor is going to damage the bladder. There's no ifs, ands, or buts. It's going to. And too much damage will kill the bladder. And if I opt to only have them remove the tumor and wait and see the damage, then I can develop more infections as the bladder dies to eventually be removed. But who knows how much damage that will be. And we'll still end up in the same boat of a tube and a bag to have to drain all the time, every day. Then my activity for that will be limited. No more swimming, no more beach. Anything that can get into cracks and crevices of that tube is a no, because let's face it, we do not want to go septic from bacteria infection from that opening and die from that. I was given a 3 to 5 year life expectancy. I'm on year 7, so I'm beating the odds for now. But then, do I shorten my very hard and long road? Or do I swallow my vanity, what's left of it, and go ahead and opt to have it removed with the tumor to have a few more years? Everybody tells me, oh, you're strong, oh, you're brave, you're a miracle, you can make it. Yeah, but for how long? My body's tired. The pain is growing higher. And yes, I'll keep fighting. I just have bad mental health days. Trying to make choices. The next scans are in August, so we'll see what that does and watch for all of the symptoms that they told me to, so that we can see how much damage is going on with my bladder. I guess kind of go from there. Cancer patients, day by day, some days, moment by moment, especially when you're fighting the terminal cancer. Thanks, guys.